Good afternoon. We have asked you all here to listen to our health promotion proposal entitled Assessment of Older Adult Walking Clubs to Prevent Falls. The objectives that we hope to achieve through this presentation are that we want to present you with our target population and an explanation of the health deficits that they encounter, as well as an explanation of and a rationale for our chosen intervention to aid in these deficits and how we would utilize the $20,000 to kick off our intervention and ensure its successfulness and sustainability. Before we delve into our proposal, we would like to briefly introduce some members of our research team, as we have a vast amount of nursing experience and knowledge. Catherine Black has been a nurse for 12 years. She currently works for and holds our knowledge of Medicare insurances. Ryan Bowman has been a nurse for 10 years. She is currently the nurse manager of a subacute rehabilitation and long-term therapy facility. Leanne Carenza has been a nurse for 5 years. She is currently employed as a wound care specialist and also holds a background in telemetry. Kristen Crowder has been a nurse for 28 years. She currently works in the oncology field and directs research for immunotherapies. She has a strong leadership background and experience in diabetes research and cardiac services. Leanna Dahl has been a nurse for 5 years. I am currently employed as a nurse educator in home health in a hospice department. I also have a background in cardiac and telemetry. Amanda Dyson has been a nurse for 15 years. She is currently employed as a clinical coordinator in an acute hospital setting. She has experience in telemetry, med-surg, and behavioral health. We feel that the combination of each of our strong nursing experiences make us an ideal team to create an effective, safe, and cost-efficient health promotion proposal. As you can see from our definition of health promotion, we believe that the health of an individual should be centered around their holistic needs, and that for the health promotion to be successful, healthcare professionals need to encourage individuals to take an active role in their health goals in order to promote optimal well-being. Our definition aligns with the mission and value statements of Desert Regional Healthcare Alliance, as we both believe that patient education, innovative ideas, and continual research are the foundations for promoting well-being amongst individuals. Our target population is older adults aged 65 and over who live alone within the community. According to Healthy People 2020, falls are the leading cause of injury in older adults over the age of 65. It is estimated that falls in older adults are treated in emergency rooms every 13 seconds, with a death resulting from a fall occurring every 20 minutes. Aside from falls, chronic illnesses are the second leading health deficit amongst this age group. This deficit can occur from lack of education or resources for self-management, which can lead to a quicker deterioration and demise of the person. It is recommended that an increase in physical activity will aid in lessening the number of falls, as well as the amount of injuries related to falls in older adults. Physical activity has also been shown to show a significant improvement in chronic illnesses in adults, especially those related to heart disease and diabetes. Even so, it is estimated that less than 60% of older adults participate in physical activity. It is also important that we provide these individuals with resources and education on how to self-manage their care and to prevent illnesses and to promote a healthy well-being. The availability of caregivers to this population, especially those who live alone, is also imperative, as they are a second resource to provide education tools to and to help monitor the patient and encourage safety measures to prevent injuries. As we have stated, the target population for our scenario is older adults over the age of 65 who live alone within the community. We chose to target fall prevention as our health promotion strategy, as falls are the largest cause of health disparities within this population. Falls are also one of the leading causes of rehospitalization amongst older adults, which also decreases their independence and can worsen other chronic conditions. Our goal is to promote a plan which enables this population to engage in physical activity in a safe manner, which will reduce the risk of falls and injury and death related to falls.
As a group, we created a health assessment tool to identify health deficits that pertain to older adults over the age of 65. According to Edelman, Kudzma, and Mandel, 2014, Majorie Gordon developed 11 functional health patterns intended to guide nurses in performing complete assessments of patients, who would encompass a systematic means of gathering pertinent patient information. In creating our tool, We researched several existing health assessment tools that examined portions of Gordon's functional health patterns and created one that would address a variety of patterns related to a person's risk for falls in the home and community settings. The 14-question assessment addressed Gordon's functional health patterns of elimination, the cognitive perceptual pattern, nutritional metabolic pattern, coping stress tolerance pattern, self-perception self-concept pattern, and activity exercise pattern. The data collected from the health assessment tool proves that patients' risk for falls in the older adult population are most affected by the coping stress tolerance pattern, elimination pattern, and activity and exercise pattern. Common to the literature, the majority of patients who completed our health assessment tool reported experiencing anxiety or worry in their daily lives, in addition to an increased nighttime urination need and non-compliance with standard fall precaution measures such as safe footwear. 4 out of 6 participants experienced anxiety, 3 out of 6 participants experienced nocturia, and 3 out of 6 participants did not wear non-slip footwear. 50% of our identified population were moderate risk for falls. 50% were identified as low risk for falls, and 0% were identified as a high risk for fall.
Falls are the leading cause of fatal and non-fatal injuries among the older adult population. In the year 2014, there were more than 27,000 deaths in older adults from falls, and at least 2.8 million patients were treated in an emergency department for a fall-related injury. Approximately 800,000 of those patients required hospitalization. To decrease the number of falls with injury, attention should be placed on health promotion activities and interventions, especially in the older adult population. Physical activity helps maintain good health, but also can improve overall function, quality of life, and emotional well-being. The benefits of physical exercise are well documented, with recommendations supporting that adults should participate in moderate to vigorous activity several times a week for a minimum of 150 minutes. Walking is a moderate intensity physical activity that is easily accessible, does not require special equipment or training, and is typically associated with low risk for injury. After conducting a health assessment on older adults, it was concluded that half of the participants were at moderate risk for falls. Risk for falls were attributed to several physical factors, such as decreasing participation activities, reporting an unsteady gait, and concerns of falling when using the stairs. Therefore, the specific intervention that is being proposed today is to implement a group walking program for the older adults in our community to build strength and promote health. For the older adult, it is critical that exercise activities are convenient and easy to participate in order to increase compliance. By having a walking group or club for the elderly to join, it would also allow participants to build relationships with others and be a means of holding each other accountable. The group walking program would be overseen by a nurse in the DRHA outpatient clinic. Participants will be recruited from the primary care offices in the community, where information about the program and its benefits will be shared with providers so that they can refer their patients to the DRHA clinic for participation. The assessment tool developed for the older adult patient will be used to help determine eligibility for the walking program, and only low to moderate risk patients will be included. Once participants are cleared for exercise with their provider, they would receive a pedometer to measure their steps, a handbook to record their exercise each day, and a schedule of walking times and meeting places for the group. A nurse will oversee the program and follow up with participants at regular intervals to help with any barriers and offer words of encouragement. To continue to incentivize participants and promote sustainment of the walking program, monthly events would be offered. These events would also focus on health promotion and may include health screenings, guest speakers, and healthy dining options. A walking program for the older adult population would be of benefit to the community for several reasons. The first reason is that falls can cause serious injury and even result in death. According to the National Center for Injury Prevention and Control, 1 out of Every 10 falls results in a serious injury, such as a hip fracture or head injury. In addition to the physical and emotional pain that is endured after a fall, the injury may cause permanent damage and consequently affect the older adult's ability to live and function independently. Another reason for a walking program is that falls are preventable. The community should do its part to promote health by making a commitment to providing a feasible option to increase strength and reduce falls in the older adult population. People are living longer, and the rates of avoidable falls will continue to increase until health promotion activities and interventions are made a priority. A final reason to promote a walking program in the older adult population is to help decrease excessive healthcare spending. Falls among the elderly population are associated with significant healthcare costs that may be circumvented if more was done to promote health in older adults. In the year 2014, $31 billion in healthcare costs was attributed to falls with injuries in the older adult population. By investing a minimal amount to fund a walking program for the older adult population, the return on investment for DRHA will be attained from decreased emergency room visits, fewer hospitalizations related to falls, and increased availability of resources to focus on other patients.
The trans-theoretical model defines the multi-step process that an individual must successfully go through in order to make real change in their behavior. In the older adult population, people are confronted with many choices regarding their health-related behaviors every day. It is important that we, as nurse leaders and healthcare providers, are able to apply the trans-theoretical model in order to recognize where patients fall in the stages so that they can assist them in making positive and lasting health-related behavior changes. By guiding our intervention based on this individual level theory, we will be able to successfully encourage our patients to participate in our walking program, thus promoting health and reducing the risk of falls. This ideology is supported by the study completed by Kozma and Cardinal in 2016, who found that older adults who successfully increased their level of physical activity through the 5 stages of the trans-theoretical model experienced a decrease in the rate of falls. Kozma and Cardinal proved that the 170 participants over the age of 65 in their study demonstrated an increased physical activity participation, strong self-efficacy, and the lowest perceived cons associated with physical activity during the action stage of the trans-theoretical model. This theory was chosen to guide our intervention because it takes into account the participants' readiness for change and because of its likelihood to create a lasting, realistic change in our population's health-related behavior.
For the marketing piece, our older adult walking clubs will provide exercise and socialization. We will place flyers in the older adult communities surrounding the hospital. We will also utilize resources that are already in place at DHRA, such as the internal TV system for the inpatients and flyers in the DHRA waiting rooms. We will also speak with the social workers at DHRA and inform them of our program because personalized face-to-face invitations are always preferable. There's always value in face-to-face invitations, and we will also utilize nursing staff in clinics and inpatient areas. We will promote these groups as free exercise programs with an added free education on older adult healthy behaviors and offer free pedometers to each participant. As an added incentive, we are offering gift cards to the people who complete the program. The flyers and the inpatient advertising will incorporate pictures of older adults exercising in their normal daily routines. Also, the flyers will contain education on basic fundamentals of physical activity and increased health. This will promote the socialization piece because it is known that seniors look for support and friendship.
To align with our interventions and marketing strategies, $2,000 of the budget will focus on community health education programs. These programs are vital to the walking program to maintain participant engagement and sustainability. Participants will be offered a walking handbook that contains a walking log, goal-setting tracker, and tips and motivators for exercise. $6,000 of the budget total will be reserved for printing and construction of the walking handbook. Marketing supplies to gain interest within the community will require $3,600 of the budget. Marketing supplies entail flyers along with the development of a short infomercial that will be broadcasted in DHRA facilities. Pedometers are key to the walking program, and we have allotted $3,480 of the budget to obtain this equipment. Our walking program markets nurse support to assess patient goals and provide encouragement to overcome barriers. The nurse health coaching will require $3,000 from the budget. And lastly, to create incentive to complete the program, we will offer gift cards, which will use the remaining $1,920 of the budget.
Measuring outcomes is very important, and it's going to be important to survey the senior adult pre- and post-intervention to determine the physiologic response, the strength, and incorporate data on their attitude to exercising and if they feel safe and accepted in the group. We will also use the tool, the fall assessment tool that we created. It is important to set reasonable outcome goals to evaluate the individual and the program. Any program should have measurable goals and realistic outcome measures tailored to the specific age group. Our goal is to keep the patient safe, engaged in activity, and leaving with a positive attitude. So some of the things that we will do is we will measure their attitude. We will ask questions to measure their attitudes towards exercise pre and post. We will obtain blood pressure pre and post. We will take a look at leg strength and motor skills and do a pre and post 6-minute distance walk and measure gait speed. And then we're going to ask them a couple of questions such as, do I feel safe during these exercises and do I feel accepted? We will be using our fall assessment tool. Thank you.
Our complete timeline for developing, implementing, and evaluating will take place between September 2017 through August 2018. September 2017 through November 2017 will be the development phase. This will entail producing our walking handbooks, marketing flyers, and the DHRA infomercial. Participant recruitment will also go into the development phase. December 2017 through July 2018 is the implementation phase of the walking program. Our walking health promotion classes will take place along with additional community health promotion classes supporting an active lifestyle. Walking groups will be formed along with the participant goal setting stage. Pedometers are dispersed to participants to track progress. Our nurse health coaches will follow up with participants to ensure success for participation. 2018 is when our team will reassess participants' fall risk utilizing data from participant walking handbooks and our fall risk assessment tool.
Strategies we will use to sustain the walking program after the funding year include strengthening partnerships, diversifying funding sources, and building capacity. Building partnerships with organizations and local groups with an interest in health promotion for older adults is a key strategy for sustainability. Some of these groups may include local health clubs such as the YMCA, social groups for older adults, and government agencies such as the National Council of Aging. Building partnerships help increase the program's potential impact on the community and helps the program reach a greater amount of participants. Diversifying funding sources includes generating revenue for the walking program. Steps will be taken to secure additional funding. Additional funding sources may include government grants and fundraising activities. Ensuring that program facilitators are knowledgeable and competent to assist participants is essential for building the program's capacity for sustainability. This will be accomplished by establishing an evidence-based training program for program facilitators. Also, informing program changes through use of an evaluation tool will increase program effectiveness and create a program with lasting potential for DRHA. One of the ways our group will evaluate the program's effectiveness is through the use of the fall risk assessment tool we developed. We will use the tool on participants at the beginning of the program, after 3 months in the program, and lastly after 6 months in the program. We will use the tool as a way to measure the risk reduction properties of the walking program. Also, after 6 months in the program, participants will receive a survey. This survey will ask participants about the program's NURS, the program facilitator, the equipment used, and their overall satisfaction with the experience. Participant feedback is an important tool to use when informing change to any health promotion program. Through the use of the fall risk assessment tool and participant surveys, our group will inform changes to the program to ensure that it is as effective as possible.
As we have explained, falls are the leading cause of injury in older adults. However, a key point to remember is that falls are preventable with the correct interventions in place, and as leaders in nursing, it is our responsibility to promote and ensure the safety of our patients. An increase in physical activity has been proven to show a decrease in the rate of falls and the rate of injuries from falls. Our proposed intervention of walking with a partner is one that is easily applicable and easy for a targeted age group to follow. Not only does walking with a partner help to promote safety, it also helps individuals to hold each other accountable for adherence to the program. A nurse will be designated to monitor the progress and the success of the intervention. We believe that if this proposal were given the chance to become a reality, it would show success in reducing the amount of falls in older adults, thus decreasing the rate of injury and visits to the emergency rooms, as well as increase their state of well-being. This proposal would be sustainable long after the $20,000 has been utilized, as we can campaign and educate others on its success, thus building partnerships with agencies that will help with funding. We fully believe in the chances of success for our proposal and would like to thank you for your time and consideration.